Good morning, everyone. Welcome into Mornings with Loretta. So, as we are preparing to gather for the holidays, adults that are 65 and over face a heightened risk of severe infections from respiratory illness, especially COVID 19. Yes, COVID 19 has not gone anywhere. So, multi generation celebrations and long hours spent indoors create ideal conditions for viruses to spread. So, how do we protect ourselves and our older family members during the highest risk months of the year? Well, I have the answer for you, and she is going to come to us. Dr. Juanita Mora is our guest today, and let me tell you, she is prepared for this conversation. Hi there.
Hi, thank you for having me to discuss such an important topic.
Absolutely. So let's just jump in there, Dr. Mora. Why are older populations more at risk for severe COVID 19 infections this year?
Well, Loretta, when we look at the people greater than 65 years of age and over, one, we know that our immune system weakens as we age. So people 65 and older are going to have a weakened immune system that makes them higher risk for COVID-19 complications. Number two, people greater than 65 years of age are also going to be higher risk for having chronic medical conditions that put them at higher risk for COVID-19 complications, such as diabetes, such as high blood pressure, cardiovascular disease, asthma, COPD, or emphysema. The last thing is, we also know, looking at just the data from September of 2024 to now, October of 2025, there's been 44,000 deaths due to COVID-19 in our country, in the US. And out of those, 2/3 are people greater than 65 years of age and over, which is why it's so important that we continue vaccinating and protecting all our population.
It is so important. I have heard countless examples or testimonies or just in conversations with people whose parents are really affected by it or their aunt or even themselves, because I hang out with a lot of seniors lately. I don't know what's happening, but I guess they're helping to prepare me. So what steps should families think about taking before the holiday gatherings? Because I asked my mom, who's coming to your house and why are they coming and are they going to wear masks? And she hates that question though. So how do we respond to that? And what can we do to protect them?
Sure. These are the top tips that I'm giving all my patients before the holiday gatherings. Number one, vaccination. Everyone 6 months and over should get their COVID-19 vaccine. So that way we make sure everyone is protected. Number two, we got to do good propagation of air within the actual good ventilation. So putting a HEPA filter or air purifier in the room where we're going to have the holiday gathering is going to be key. Three, if someone is sick, I completely agree with you. They should be wearing a mask, especially around our most vulnerable. The little newborn babies, the actual older adults as well too, so that we keep them safe. And number four, that people continue to test. So if they have any symptoms that look like a cold, that they go ahead and buy a COVID-19 test kit and test for it, because we might be dealing with COVID-19 and you do not want to bring it to the holiday gathering.
Mm. We do not. And so this question that I'm going to ask you is just to kind of set the tone and give people some information so they can make informed decisions, because it's not a one size fit all. You're an adult, we get to make those decisions. But there has been a lot about whether we should get the vaccine or whether we shouldn't get the vaccine. So where should our audience be looking for guidance on that important decision about the vaccinations, COVID-19 vaccinations?
Well, when I talk about conversations about COVID-19 vaccines or any vaccines, I always tell patients, one, your most trusted messenger is going to be the doctor, your primary care doctor who you trust, to start having the conversation. So if you have doubts, you ask them. They lead you on into the science. Two, you can also look at trustworthy websites where there's lots of wonderful vaccine information, such as the Champions for Vaccine Education, Equity, and Progress, cveep.org. They can also go to their local Department of Public Health's website where they have all that information as well too. And when it comes to getting the actual COVID-19 vaccine, they can talk to their primary care doctor or their local pharmacist. Most are really well covered through actual private insurance, Medicare, Medicaid. So really, we're trying to bring down any barriers so people get vaccinated and protected.
Great information. She gave some resources. We'll cite them on the screen so you can find them. So I want you, it's a double question. What is long COVID-19 and what should we know about long COVID-19?
Sure. Long COVID-19 obviously is a complication from repeated COVID-19 infections. So people who get long COVID symptoms, most of them are going to be high risk for it because they've gotten COVID-19 infections quite a few times. So number one thing is getting protected and vaccinated is going to be the best thing you can do to avoid long COVID. When we talk long COVID, remember COVID-19 is a very inflammatory virus. So what that means, when it goes to the different organs, it causes complications. So when it goes to the heart, it puts the heart of people at risk for arrhythmias and even heart attacks. When it goes into the lungs, it causes those new onset asthma symptoms, COPD or emphysema. When it goes into the brain, it can cause a stroke, and it has also been linked to the development of Alzheimer's. So obviously, we want to make sure to keep everyone safe. Part of getting safe is not getting COVID-19 infection and getting protected with the vaccine so that basically symptoms are going to be lessened.
I know, we do the vaccinations and we're taking care of ourselves. And then some people get COVID more than once. Is there how do you know a person who's had it more than 5, 6, 7 times? And how can we protect ourselves from that, if that's even possible?
Oh, yeah, absolutely. So obviously, yes, I know a patient, 32-year-old, who actually wound up having new development of asthma from long COVID because he got COVID-19 infection 5 times within the last few years. And so he's had a lot of complications from it. So main thing is I do tell him to wear a mask around family gatherings, especially if it's going to be a lot of people, because that's going to help to basically decrease the risk of COVID-19 infection. Vaccination is going to be key. Good ventilation in the area as well, too. Universal precautions. And obviously testing early too, a COVID-19 test in case they have symptoms, because we have medications like Paxlovid that basically decreases the amount of symptoms that people get. So that's going to be helpful as well.
Oh, wow, you know your stuff. Oh, I'm going to watch this again myself because you shared some nuggets that can really, potentially help save lives and at the very least prevent people from having COVID-19 once or 7 times. So where can we go for more information for our local guidance and access to COVID-19 vaccines?
Sure, they can go to their local Department of Public Health websites where they will see listed COVID-19 for even people without insurance, because they'll run local free clinics as well too, where they'll be able to get COVID-19 vaccines obviously free for people who don't have insurance. You can talk to your doctor or local pharmacist that usually carry COVID-19 vaccines as well too. So it's important. But yes, please get vaccinated, get ready for the holidays, and that means protecting everyone who sits at our table.
Everyone, whether you believe in it or not, or something you want to do, but just think about protecting other people. They're not making the same decision that you're making, right? And so they may not be doing the precautionary things or the preventive things. So let's wear a mask, especially around those who have compromised immune systems and they're older Americans, like 65 and older, and certainly those that are older than 75 and 80. Let's protect them. Don't think about ourselves. Let's be selfless and think about them. Well, Dr. Juanita, thank you so much for being my guest. I hope you'll come again.
Absolutely. My pleasure. Thank you for having me.
Absolutely. Thank you. Happy holidays.
Happy holidays.
Bye for now. All right, so let me just tell you about our guest. So Dr. Juanita Mora expressed interest in preventive care and medicine at an early age, like a little girl. She graduated from the at the University of Chicago, medical school at University of Illinois College and medicine at Chicago, followed by a combined residency program in internal medicine and pediatrics at Rush University Medical Center. She's very knowledgeable. She's dedicated her entire life to respiratory care as a respiratory specialist and just want to keep us all safe. So do the research. Decide for yourself whether you want to or not. This is not pushing one or the other. This is just giving you information to make an informed decision. All right, we do have another segment coming up, so don't go too far. We'll be right back with Mornings with Loretta.